Okay, una kusha una kabo. Na my name Timu John Fuller. Na me na the host for the Bɔdi Bεttεh past Gentri program. We are the Salon Organization of Greater Manchester na in the Brian Canto we. Do you have a family them and they ask say this program now for giving no more generalized advice. We're not there for advice any individual, on how you for live your life. We only they give generalized advice as to how we all be able to make your life better. If you get anything when a personal stuff we want to discuss, when a health related, you are the big say let you contact your GP or your medical professional for let you get that one-to-one advice. But yeah, not generalized advice somebody give on how we for able to live your life healthily and the signs and the symptoms and where we go experience and what to for do if we go see the doctor, what to for able to explain to them waiting don't do it. Okay. All right. Like I said, I'm in John Fuller, but not only at the show. And today we deal with long COVID. So I'll go through the team with quick as to the people who I will get on my panel. We'll be able to help on with the show today. Then I'll go hand over to Uncle Doc. We will take on through the show. And at the end, if you get any question, we go able to answer the question in there. Okay. Today, like I say, we do with long COVID. Okay. We look at the vaccine. We look at how you go able to manage them, and we'll also look at the different variants within COVID-19. Within the team, we get Uncle Doc, when I present to you today, Dr. Mohamed Kamara, when senior emergency medicine consultant in Manchester, and also now the group lead. Yeah, so now know any group or organization we get, you need somebody with the as the ababa, somebody at the top. So now Uncle Doc. Okay. The next person we'll get at the team, now Sisirugi within our panel today. Now a mental health nurse and also now a health visitor. So if anything gets for do with mental health or something for do with community health and stuff, Sisirugi will be able to provide on our advice. The next person will get now Mr. Ibrahim Sise, instead of the panel. Now a qualified social worker and also now a mental health advocate. So if I get questions, we want to ask. If you feel say yes, you get a valid answer for add, you go add them for now. Okay. We also get Miss Fatima Kuroma. We nutritionist. He specializes in black man kind of food, but today Fatima not do with me, unfortunately. But if you join me at any point in time, I will make sure I introduce them to you. Okay. The next person we'll get now with Dr. Aziza Sise. Himself not there with me today, but if you join me at any point, I will make sure so I know. Instead of getting your own show when I talk with Dr. Sise, normally he can present to me, but because of some family issues, you're not going to deal with me today. Okay. Now a GP, but if you join me at any point, because until he can join, you're not can tell me, but he can join. But if you join, I will make sure so I know. Okay. The next person we'll get now Dr. Mohamed Z Toure. I think say for the now miss today, I'll check, I'll confirm towards the end. Now a GP, now I don't present to we for the past 2 sessions in will be all. Now I been present to we. He qualified in other areas, not just general practitioner, but you get other areas of expertise. So if I get question for us, like I say no more, we get a variety of team of people that we get experience, we be able to do our advice. Okay. The next person gets now Mrs. Aisata Guba. We now Mr. CB don't join me before. If himself they in the capacity for add any value to any question want to go ask, he go answer on a mental health nurse and also a social worker. Okay. The other person again I would team now Mrs. Fatmata Kamara. As far as I know enough for day with me today, but if you join like I say no more, if I notice I'm a day, I will make sure say una know, I will tell una about them. Okay. Now a mental health nurse himself, and himself if you now get any questions we relate to mental health or something where you feel sick, you will add value on, it will give una advice on that. Okay. The other person where we can get now Miss Aminata Jallo. Unfortunately, as far as I know, another for day with me today. But normally, now we clinical pharmacists, now you can talk to we normally around medicine, how for take medicine, how for look after medicine, anything for do the taking of medication. Now that I specialize in, I can give you advice on that. But as far as I know, enough for day with me today. But if you join, I will make you know. Okay. Right, the last person, the last but not the least, like myself, like I've been saying, I'm in Timu John Fuller, I'm a business IT consultant. And all day I have to give medical advice. Myself not just like una, most of una we myself curious about a lot of things, the medical issues where why then I have for just make sure say this team they together they able work and present to una every session we'll get then come to una uninterrupted. And I'm my own job now. So okay. So now at the end, dear, at the big say if you get any questions, advice, or suggestion as to how I feel say we will become better, or topics that wanna go 1 year, or maybe when I get something where you want to ask, but maybe during the show, maybe you be a bit shy, or maybe you be in an environment where you're not able to talk, and you want to ask, feel free for send me an email. We will try for answer you. Okay. Also, dear family at the big, if anybody interested for joining the show, if as a guest or maybe in a medical professional, and if want to join, please reach out. Okay. And also, if anybody gets the facility for able to make this show reach to people in a salon, maybe through radio or TV, we're not a charge anybody, but if the radio channels then show interest, we will be very happy for do them for them for free. So I don't come to the end of my own introduction. I go hand on over now to Uncle Doc, but family can't be seen no more. I'll get for mute everybody during the time where they present. But once you finish, we go open the floor and everybody will free for answer. Okay. So Uncle Doc, when you're ready, sir.
Tell people one thing.
Uncle Doc? Thank you. Go ahead, sir.
Right. As I say, thank you for joining me today. This evening time, this sick, as we all know, it don't the money away. Now we the black man deny the money pass. We other one day we wait comping them. Now we all they talk about time. In fact, before I can join in, so before I can present, so I just come out from the one with them present in Leeds this afternoon. We again at the same thing, no more just for trying to get to people and for understand the seriousness, the importance of this sick, and of course the only way we know saying that the way that we go for try for help people and for make will not die needlessly, avoidably, as the Englishman can say, because if we get this opportunity like we get, and so we get this vaccine, this maclate, and we take them, we pray God say, go bring we na hospital where then go get for put we under machine. But as una go the yeri, as they talk they go on, as the presentation they go on, I go see exactly what they talk about. So what I can do, I can begin me talk, I can always, if this could go, oh boy, that's it. I want, TM, if you're able to unmute people and make a gesture, this thing is really scary. For me, I'm afraid of. But I don't know who that know waiting at this thing. So where they begin to talk, they can always begin with an icebreaker. So if anybody know waiting down they do, make them must tell we. Anybody?
A needle.
The needle, good. Any other person?
Yeah, I think this nine they use for put down the throat for open like if person.
Cutlass.
Yeah.
The cutlass, okay, right. We get needle, we get cutlass. We get this one, then they put down the throat. Anybody else?
Nine they help for like the sit down, waiting the up and down.
Okay, and okay. Naturally they help for look for see waiting the up and down. Anybody else? Okay. Well,
They call a laryngoscope, then they use for intubate people there.
Excellent, brilliant. Thank you so much. As I say, me that this particular thing I think I'm afraid. As you see, not all men shall be waiting to do. So the message clear. If you stay now, you host. If you sit down now, you host. You not go able to find out what this thing be. But this is not the situation. Now the answer is get two types and get the one way straight and you get the one way bend like this one way bend so. Then call this one Macintosh laryngoscope. This one, the adults, them, the big people, them, then they use this deeper. So then they use them as percentages now for look, for see inside that voice box there, inside the throat there, for let them put the tube, we go up for let the person they breathe, for let the person they blow. So he go for tell you, say, this thing, now one of the things them way the maclate, the help we for let will not come in contact with. A person come in contact with this, well, that means the sick tranga. So the sick in tranga 1, they determine when then they use this thing. If you come to me now A&E, I use this thing and you, no say no one now say, it's tranga. But sometimes some people they now up now the word now and then go get for use and pandemic. But we're going to find out as we're going to. But this now the Macintosh laryngoscope where now they use for open the voice box for lead and put the tube where go help the person where not able to breathe on his own. So you find what we talk about this sick, we could talk, generally within this sick. We all don't know I'm saying a COVID-19, but within a COVID-19, well, if you look at CO, now the corona, we na queen, you get crown pan and make them call on corona. So corona, VI, the virus, and of course the D, the disease. And the 19 where you see so now the 10 way they find. So now Wuhan inside China and then find I think November, December 10, 2019. As you can see, we don't come in contact with this sick, their virus are not to want and not to treat them. We know how we live with them on a daily basis. Every day, every year, we get flu vaccine. We know say one time the SARS COVID-1 we don't come. So, but the nice for we know say the virus are in a 4 type, the 4 class. Then get the alpha 1, the beta 1, the gamma 1, and the delta 1. Then the alpha 1, and they give you this flu, they get every season, especially when the place cold like I also. And then the beta 1, and they give you this COVID. So as I say, one man they say outside this thing come out. Well, the world don't know 7 type already, as you can see. COVID-2, MERS, where they come out now, then Middle East, Saudi Arabia, Kuwait, Dubai, Qatar, all the places that they, and they in bad past this COVID what we talk about. And then you get the first one I talk about this COVID number 1. Then you get the other one like 229, NL63, OC4, and HKU, all that. So now 7, 9 the world don't know. But look at what they happen. Inside the UK, we know about 6 different types. The one will be the deal with all throughout last year. Look how it don't change itself. You see, you get one way come out Kent. We on a B117. You get the one way come out na Bristol. You on a 2021 or 02, if you know the number. The one way come out Liverpool, look at there. They near we are Liverpool. And then if you look at the Brazil, where you get 2 types, you get type 1, type 2, Brazil. And of course, the one way we all the but the South African one. This then they cause we headache. But I tell you what, not to the end of it, Daniel. You see, we need to think about, say, this thing, the world as we know, not to COVID no more. We talk about pre-COVID, like how we know before, in COVID or during COVID, so intra-COVID, and then after we know if we deal with that, we get post-COVID. Now, I tell you what, we're looking at 10 years. Like 10 years until we go for manage for deal with this thing. I need the schedule now, but if we not take time, this negative will bring a lot of problem for me. And need to me talk about this now. One very renowned professor, one lady, when named Professor Peacock, now in talkers who say it's possible to say this thing go take with me for the next 10 years. But if we take them at late, we go for control them, we go go, put them under check, and then we don't go so far. But look at this. If you see that the 6 number we know about, just look at this. You will get the first one, now in this purple one, waiting to win what we all sabi. We look at this yellow one, now the South African one. Then you get, believe it or not, you get Nigerian one. Now I don't mean for be personal, but as you see no more, inside Africa, they did this the Nigerian variant. Then if you look at the green one, you go see say Brazil, we fumble them. Then get the new variant. And then inside America, see where American man then sneeze, now we the oh boy. Can we meet everybody, please? Okay. So Ohio, then get 2. Then Texas, who's at this wala just for them, so that water they because of the freezing temperature. Then get their own added problem. And then you go see Brazil get a second variant, and then Germany self get their own variant. So as you can see, all over the world, now so this thing just they scatter. Now so this thing just they change like Camille. I almost wonder whether this sick now Camille or not, but not to Camille because Camille in get life. This sick now not get life at all until it goes inside mortal man until we get life. But if fine, let we know about this sick here because you see this sick is very difficult for distinguish for actually for take one from the other. If you see them all, the cold, where people can get cold. Now, if you get cold, you sneeze, you cough, they say, oh, coronavirus. You know, you look at the flu, you know, what they get every year. Again, if you get the symptoms behind that, and of course, people and they will get this allergy, we can cause problem for them, you know, like how they cancel towards spring, so man can get this allergy, bad one, and so man can get something they eat, some kind of fruit, some kind nut, or some kind of medicine, you end up, you face swell and throat swell, you know, and of course, you get this big one. Now, for people in a free tongue on us alone, then get the fifth one way in a malaria. Now, if you look at their symptoms, yeah, fever, that, pain them, that the body, that the muscle them, where you weak, you tire, you know, and as you begin work no more, you begin feel out of breath, you know, get exhausted, you know, your nose block, your nose they run, you begin sneeze, and then of course you get sore throat. All them things, yeah, they're very common, but then get differences there as you can see. You know, if you look at the COVID fever, they can say no by day, but if you mix with other things, you will get that. Headache, definitely, that they know about. I'm saying they in a part of that. Even when you take the maclate, you can get some headache as they know. Well, the most important thing when I can talk about now this fatigue and this exhaustion, you know, where you just tire, your body tired, and then you begin working no more than that. This thing stronger. I can go into the details, but I don't think say when I need that because when I see for myself how we difficult for let we tell say that this sick you get from the other one, you know. So, but we get specific symptoms the way we know say we know they come across. And if you look at them, you go see say nowadays we don't get new one them. You know, where somebody talk about this thing within the foot. You get a bluish, like a blue swelling, blue rash within the toe them. They call them chilblains. Now important. I know say one point them. Small picking, about 3-year-old in mama na Somali, in papa na Ethiopian. And Kantowi, they say this babo, this picking wear these socks. We don't know what happened to her, what happened. We just say, we see this thing, and this babo, they run about, they do all kind of thing, but we don't know what happened to her. When we press the thing painful. We say, enough for them? They say no. Okay. So because it is well, we don't know what happened to this picking, we say, okay, let we x-ray her. We x-ray her, we not see nothing, but this thing dip on this foot. Now we say, wait till them. We don't tell we say they get this thing they call chilblains. So make we actually talk to mama and papa for make we see whether they go do this test. When we talk to them, then decide, we don't know, but yeah, we'll test the pikin. And guess what? When we test the pikin not get this sick. But 2-3 days later, mama and papa begin sneeze, begin cough, complain of sore throat, and then they lost the taste of smell, taste, and then smell. Next thing we realize when we do the test, 2 days later, they tell me say the test positive, by mama and papa, but the pikin not get it. So let we see no more. You see. Most of the time, when they talk about fever, cough, where they continue, where you know, just begin by they continue, and then if you lost your smell, sense of smell and sense of taste, but then look at this tongue. Yeah, so man can be saying sometimes malnutrition, but this is what the COVID tongue look like. Where the COVID the ravage the person, and so the tongue can look like. So let me now understand no more. You know, I know one me company who they work in tell me say the first thing when you see, you know, be no say get yourself. And now he knows in the end 90 and where na conjunctivitis in your eye begin red. You know, I know some people that will get diarrhea when that you will not be talk about. But these are all, you know, all that are signs and symptoms of this sick. You see? So we need to know about that. Of course, things like the blood clot and all that thing, and there's some myself get problem with years. You know, if he get to the point where he begin hearing this ringing. Now, if you get obviously a tongue like that, or you get aches and pains, lumps, then you get it singing in the US, you find for let you get yourself checked out because possibly na COVID you don't get. So I did talk about this sick, but obviously you find because this sick, some man they say you know they affect black man, some man they say if I go take me akbacheshi, I take me mampamabuli, you know go catch me, I go steam, I go take shekuturi. It's the joke, the hamburger self, because this sick no they reach na belly. You know, when you drink that akbacheshi na the belly they reach. This one no they reach na the belly, na the chest, na they tap, na they stop. So look what thing they happen to this one. Normally, na the chest X-ray this. So sometimes some man know waiting at this thing. Na the chest X-ray this. If you look at when the person don't better now, so it time. See them white bit here, this white thing where you see so na the heart down this black bit where you see na yeah, na the lungs then down and then white line here, na the rib them. You know, and then at the right, then at the left. You know, and this part where you see that white with the bottom here, na the belly, na the stomach down the abdomen and down So that thing will differentiate between the chest and the belly and the diaphragm, like this. So. But normally, it black. And you can see, they land there, all they reach to the edge now, outside the rib their end. But look, compare this one and to that day. You can see, like, say, na storm, like we ice they for them. You know, now so they begin. Then call them ground glass appearance. If you watch no more, you go see, say, like, we grain glass. You see, it begin from outside now, then it begin get towards the center. So it come up peripherally and come towards the center. By which time, if you look at this, no place, not the way black again, they're all white, and that means this person will get difficulty to breathe. To the extent it can actually collapse the lung. Now, this picture where you see we get the arrow, yeah, they show you this part outside the lung go left. Compare this one to this one. You can see, yeah, all black, and that bit now the lung don't collapse. So this kind of person, it's possible to say this person got difficulty to breathe. You know, because of that, this lung no go expand on you know, we get for EPAM, and the only go for EPAM and for put this tube we call the chest drain. Now that go up for pull the air, the breeze come out so that the lung will expand and then the person will breathe again. If this thing no expand, it's possible to say it will collapse completely and then it begin get problem from the heart, it begin cause problem from the heart. But this man what they show now in picture, he only not only gets on one side, he gets on two sides. So we go for put two drains there. After a few days, he better and so he turn. Okay. So I don't talk Boku, but I think say we need a breather. So I think say this video is important for Leone listen to them because we can do they can't talk about this thing we don't call long COVID. The long COVID, we not go know about them, but the only way you go know about them now when you know person way don't get this thing. So now listen, yeah.
Members of the club, no one wanted different backgrounds, ages, experiences. Thousands and thousands of us have been struggling for weeks and months with ongoing symptoms of COVID-19. These are some common symptoms, but there are many more. Some of us have been ill throughout, with others having relapses. We're still very ill. We're feeling pressure to return to work, families, get back to normal. We still feel anything but. No one seems to be able to answer our questions or give reassurance. Will we ever get better? Will there be long-term repercussions for our physical and mental health? Is this post-viral fatigue, or are we still infectious? Will I be able to do the things that make me happy again? Can we hug our loved ones, or will we make them sick? Is this damage irreversible? Am I to die? We just don't know. So we're sending out an SOS. Each of us has our own journey, but lots of us are feeling abandoned, dismissed, brushed off, ignored, and given conflicting advice. It can be hard for those around us to understand how ill we are. It's confusing and scary. Our numbers are growing and we need to be taken seriously. We need rehab, research, and recognition. We need to be believed, helped, treated with compassion, and supported by those around us. Please hear our SOS.
William. So, oh no, sorry, a different one than not than the I want. Not this with the painted. Oh man, this thing I need for put them forward, but for some reason it caused me. Okay, make I go with this then. So go to the opener.
Dr. Kamara did not. Dr. Kamara, I need to.
So, what Amala we do, if you not agree with me, now probably, oh man, come on, I don't want this thing. I need it to stop. I need. Sorry about the technical issues. I'm trying to get this to skip. No, that's the other one. That's not what I need. This is the one I need. For some reason, it's not allowing me, but anyway, I think I'll go forward. That's it. So I think what we should do, as I promised earlier on, is that we need to probably speak English. So at this point, TM, can you unmute Mrs. Ann Binks, please? Yeah. Is that okay? Yeah. Hello, Ann.
Hello. Yes,
Can you hear me?
Yeah, I can hear you.
How are you, sweetheart? Are you okay?
I'm not doing bad, Mr. Kamara.
Thank you so much. Folks, please welcome this wonderful lady. Yeah, she's volunteered to come and speak to us, you know, about COVID, what she went through, how it was for her. And I thought there's nothing better than a lived experience, somebody who's actually been through this and somebody who's then needed to take the vaccine because she wants to prevent what she went through to happen to anybody else. So thank you so much for this. As I say, not many people can come forward and do, you know, to do this. So we're really grateful. We're passionate about this, and we just wanted you to give us, you know, a brief, if you like, insight as to what it is like to have COVID. Now, if you want us to do it interactively, we can do that. If you want to just do it as a presentation on your own, in your own words, that would be excellent.
Yeah. Interactive.
Interactive. Right. Okay. So how are you feeling today?
Tired.
Right. When you say tired, what do you mean when you say you're tired?
Lack of energy.
Lack of energy, right. So could you tell us how this whole thing started, you know, when it is you realized that you were unwell and what it is you did and how you were feeling at the time?
It was about 3 weeks ago, Mr. Kamara. I went into hospital.
once you're symptoms before you went to the hospital.
Sorry.
Yeah. Well, I mustn't forget. Sorry, I'm interrupting you. Mr. Binks is is next to Mrs. Binks. I'm grateful to you as well, Brian. You know, the two of you are really my heroes, as you know. You know, thank you so much for offering to do this for us. I didn't
It's a pleasure to do it, Mr.
Thank you
Kamara.
very much. Yeah. So, as we were saying,
lack of energy.
Yeah.
I had bad heads, shortness of breath, a cough, a constant cough. I couldn't, once I started, I couldn't stop.
Right.
And obviously a cold.
Right.
Feeling very cold, like a fever.
Right.
My temperature had gone up to 38.9.
Right.
My SATs had dropped to 85.
Yeah, so members, that saturation, oxygen saturation had dropped down to 85, yeah.
Yeah. And my rests were about 30.
So the number of times she's breathing per minute is 30, and we know the norm is 20.
Yeah. Very short breaths.
So short of breath, that's right, okay.
Yeah. If I got up, I just felt as though I was going to collapse.
Right. So what clinched it for you? Why did you decide you wanted to go to hospital? Because I don't think you were willing to go to hospital, were you?
Well, no, the doctor, I'd got some antibiotics off the doctor.
Right, that's the GP.
Yeah.
Right.
And they didn't do anything. So I rang up for some more.
Right.
And then my GP rang me on Friday and said I needed to go into hospital.
Right.
Because I was constantly coughing and stuff like that and generally feeling unwell.
Right.
So Brian called the ambulance.
Right.
They came.
Right.
They did all my observations. I was on 15 litres of oxygen.
Right. That's the highest, ladies and gentlemen. That's the highest you can get in hospital. 15 liters. That's 85% oxygen. Yeah, carry on.
So I was on 15% for 3 days, and then they dropped me down to 8%.
Yeah.
8 litres for 2 days, and then they just gradually brought me down, and then I had a nasal cannula on 4 litres.
Right.
From the Friday to the Tuesday, I had antibiotics IV, breakfast, dinner, tea, night time.
Can we meet everybody else, please? Yeah. So IV is intravenous. They give the antibiotics in the vein, you know. Yeah.
Yeah. And I had oral antibiotics as well.
Right. So both oral and intravenous. Yeah.
Yeah.
Right.
I was on steroids.
Right.
And I was on nebs.
Nebulizers, yeah. The misting instrument that helps you to open the lungs and breathe, right?
Yeah.
Okay. So,
and
yeah, go on.
The consultant, when he come to see me in A&E,
yeah,
he DNR'd me.
Yeah. So, ladies and gentlemen, just take note. DNR is do not resuscitate. It's now being changed to DNACPR. Do not attempt cardiopulmonary resuscitation, which means in the unfortunate event that the heart stops or the patient can't breathe, nobody will be jumping up and down the chest. Can you imagine that? This lady is not very old, is not old at all. In my view, she's middle-aged, but yet, see what's happened. The consultant came and actually decided that we are going to not resuscitate you should the heart stop.
And also, he said the breathing pack, if I got worse, I wouldn't be put on that. I would be made comfortable.
Yeah. So
until obviously I passed.
So what Anne is saying is that there are stages of management, you know, treating the chest infection, the pneumonia, they call it COVID-19 pneumonitis, inflammation of the lungs. You get the high flow oxygen, and then, as I said, you get the CPAP, as we call it, you know, which is like a mask. If you imagine you're on the motorway and doing a 70 miles an hour, and you put you wind your glass down and you put your face out, in the wind, that's how it feels. That's how that mask is. It's so uncomfortable. So, and then if that doesn't help, then obviously the next thing you realize is probably they'll be considering to put that same instrument that we talked about, the laryngoscope, where they will paralyze the lungs and they put the tube down the throat for you and for the machine, the ventilator, to breathe for you until the lungs can recover, you know, enough to actually maintain the function or the functionality of breathing on their own. Yeah, carry on.
And also, the consultant said to lie on my stomach because then it opens my lungs up.
Yeah. So, ladies and gentlemen, what Anne is describing is what we call proning. You know, when someone is lying on their back, that's supine. And when you lay on your front, that's proning. And we know that it's worked in patients who have problems with their chest. And this is no exception or no exemption. It's been known to work. So we even do it when patients are now put to sleep. We call it awake proning. So we put them on their front, and that helps to aerate, to get the air into the lungs where it's not necessarily getting to it, in order to help get all the muck and all the secretions out with a way of healing it. Yes, Anne, carry on, please.
And it is real, this COVID-19, and it's dangerous and it's very frightening. And especially when they said they'd done the DNR and the breathing, I was thinking, am I going to die?
Right. How does that leave you feeling when somebody comes to you and tells you you're not fit for resuscitation? There's no way we're going to jump up and down your chest with that.
Well, at first, because I was so poorly and didn't realise how poorly I was, it didn't kind of register.
That's right. That's right. So, ladies and gentlemen, you know, sisters and brothers, this normally is a decision that we come to as medics. It's not a family decision. It's not a legal decision. This is a medical decision. However, we need to actually notify the family or even the patient in front of us. If the patient hasn't got or lacks capacity, then we have to get somebody else on board, maybe the next of kin. Now, you know, in this case, this lady, Anne Binks, was definitely unwell. She wasn't thinking properly. She wasn't thinking straight. And for them to actually say, we've discussed it with her, I think is definitely an error. That was definitely incorrect, and that is not the procedure.
Yeah.
So apologies on behalf of the, you know, my colleagues for that, and that should not have happened at all. And thankfully, as we know, she's well enough now to be discharged. She's gone home, but therein starts the problem in terms of the long COVID, which is what we'll talk about. Yeah, so she's going through that now. And as I say, I thank you so much. I don't want to get you exhausted, but I'm really grateful. And I think the team that is here today, the audience that is here today, would have learned a lot from your experience. Thank you so much. You can leave us if you want to, but if you want to stay and see what we talk about, by all means, we'll more than welcome your presence. No questions about that.
Yeah, if it's okay, I'll stay, Mr. Kamara.
Thank you so much for that. Yeah, probably some people might have personal questions to you in the end, and that might be really useful.
Yeah.
Okay, thank you so much. Right, so we'll prolong because I'm conscious of time and the time constraints. Oh, God. For God's sake, stop it. No, this thing is really doing my head in. Why is it doing that? I do not know. Anyway, so let's go with this. So I'll give you a timeline of another patient of mine. Not talk about Krio. I don't forget in Krio at the talk. So this patient, what I talk about, himself get this COVID-19. He feels and a doctor, my colleague, he actually came in contact with this virus on the 20th of May. So if you look at it from the 20th to the 2nd of June, now about, you know, more or less 14 days, we're in the incubation period. We're in the time where we come in contact with the sickness, and then the sickness begins by full time. Now that, so day 0 of that sickness day, the 2nd of June, now you notice they begin get this problem for breathe, they get this cough not stop, and of course they feel weak, you feel tired, the muscle and the heart, the joint and the heart. So he sit down now also, battle with them, do all kinds of way able as a doctor, a very senior doctor at that. Now he decides, say, well, make I go do my test. He go do his test, and within 3 days, now the result comes, say, bam. He drop the clang and say, yes, indeed, you COVID positive, you get COVID. So, himself begin mend himself, begin do all kinds of things to himself, and then within 6 days, from the 5th to the 11th, this sick not better, he didn't feel any better. Now he decides, this one, I get for bet the bullet and decide for Camino. I don't want to do them, but I get for coming. And indeed, you know, not all my one coming, and I don't go advise people and JJ, you can't come. No, you get to think about, you know, do what you get for do. And if you see they improve, they get better, then obviously enough for try and get hospital as best you can. So on the 11th, he ring, and indeed, where the ambulance come, they look up and they say, this one is saturation, then they're low, then they're down to 86, 87. We know things will go left in there. You don't try your best, you're able, so yeah, let will take you go. So they bring and come to me. And then, of course, I know we get no choice but to make sure say this woman admit her. So we take our hospital, we look at you, we see if we go for menu and turn you back and return you na host, or we keep you, treat you, see say you better, and then send you back na host, or we take you in and admit you, and when we admit you, we go begin that treatment that we will talk about when at the CPAP, and that no work, then we will think about intubation. So because this woman not improve, a few hours later, by the time you realize this woman we don't admit them at the intensive care unit. And when person go to the intensive care unit, say the sick stronger. But luckily for them, the tender it begin feel better. So all the treatment with them then talk about the blood clot, then talk about the steroids, then talk about the anti-inflammatories. Yeah, with them he help them. So they bring them out to the less, serious area when at the high dependency unit. It did another day, then step on down. This is not what we use in our medicine. If you come out ICU, they bring you down to HDU. That means you don't get better. And they pull you from HDU, they bring you down to respiratory ward. When at the COVID ward, that means you're definitely well enough for let you breathe on your own, and they're not going to think for care. You go back to the ICU. So look at that. From the 20th of May, On the 14th of June, they actually discharge Kandong or step and down to the respiratory. And then the 22nd, now the 10 days before say you don't well enough for let you come home. Just like how we other patient they talk to register. So look at that, 21 days, 3 weeks. So that brings me to this next question. We talk about long COVID. So that's it. All the people who don't suffer with COVID, they're all going to say 1 out of every 5 people who get COVID, they will get the symptom then. We will continue, for up to 4 weeks, 5 weeks. And if you go beyond that, then that person, then they call them, say that person, they suffer with long COVID. All right? So between 4 and 12 weeks, definitely the person, they get the same symptoms there and they continue, even though they're not discharged. It means this person don't get long COVID. So with this long COVID, what they talk about? You see the symptom then. They affect from head to foot, from the head to the toe. That's where they affect all the system. If it affect the nervous system, you go see say it can cause even feet, seizures, and it can cause problems with the nerves then. If you affect the skin, you go see say and you go lost here. If somebody will take radiotherapy, chemotherapy, you can lose here, then you can get bruising, and you can get some lump the way it develop. If it affect the heart, it can cause what we call myocarditis, when the inflammation of the muscle of the heart, and it can cause the heart to beat fast, which can cause blood clots as well. If it affects, as we know, the lungs, you can get that pneumonia. It can cause chest pain that we can give you even blood clot. And then of course we know say they affect the smell, sense of smell, the sense of taste. So man, in fact, the sense of taste so bad that he need to taste nothing again. What did they do now? They eat the thing, and when you eat the food, now from the food, now you can take for no say this one na beef I they eat, this one na fish I they eat, this one na chicken I they eat. Let's see how this thing there. Nyama people. Tinnitus, as we talked about earlier on, it make the ears the ring, and then of course we sister them, we mama them, we auntie them, we picking the girl picking them, then can get problem then with this the monthly period, the woman business. Of course we talk about the muscle, the pain of the joint, the pain of the muscle. And I get one my colleague where get none of the symptoms, but wait till you get back pain. So back pain no more now you get where you go check yourself, definitely positive. And the big one, mental problems. They fog the brain. You need to think clear. And of course, they cause this anxiety. And the person there, you don't get depression already, this thing can worsen. It can worsen and it can make them even worse. So as you see no more, the whole body, I don't get time for go through that, but not easy for that. So from head to toe, this thing they affect. But now we tell God say, we government Naya and all over the world, they don't decide say then go get something for Epwe. And as you see, I know more then see how they provide for it. When I can see this bad man with the Konaya, well, instead of don't taking on, just for sure, and I say, I the practice which I the preach, 9 day. So as you can see, the 4 way we know Naya generally, although they get a lot more way they work on, you go see I'm saying the Oxford AstraZeneca one, the Moderna one, when American one, the Pfizer one, when a combination between America and Germany, and you get the Gamaleya winner, the Sputnik winner, the Russian. If you look at the cost, we own the cheapest one, the Oxford one, the 9 cheapest all. At the same time, now you go put in a fridge. So all the GP them and all the other healthcare, worker them, then district nurses, they can kind of host can give to the patient. Because we didn't do this one, you be able to keep and that way. But they all the 4, they need 2 injection. Now then they work on the fact that they want for make then try to get one way, they say now 1 injection more, just like how we can top up for the flu vaccine. If you look at the MMR and the picking then they don't want picking, they will tell you now 2 vaccine you need, 2 maclet now you need for lay you up to speed for increase that. But if you see the Pfizer own now -70, 9 for storm, and India, and they own a 15 pound, $20, so you get for melt time, you get for bring and count down the temperature where you go then put them in, but they all, we will look at them. Now virus, they win the left, not the body, they need to interfere with the DNA at all. So look at them, as I say, if you look at them, then get the one we will not talk about, this Johnson & Johnson one, instead of the pipeline in America. Then the Novavax, we all man they talk about, the new one, we they not approve of it, but it still did work. So as you can see, one thing where you need for look at is that this yellow thing. Now the important thing that remember I showed that instrument at the beginning. Look at what this thing they do. 100% for all the 6 it definitely they prevent you for come in hospital. And it prevent die. So for all the people that we don't take them, they not die. They not catch the coronavirus illness where they end up they die. No. Obviously, as you see, the level of protection and all that different from one or the other. But if you watch all of them, they all get 100% protection from hospitalization and of course die. This is not the other one that now when they look at, you get the one way now one way through the virus, now they go as a vector. Way now in the past is sick, the vaccine they that now work. You get the other one way now the whole virus way that don't pull all the power upon them, inactivated, so they call it. Then you get the one way now live one, but you not get the power like how the virus did. Then they get the one with the protein, protein of the virus, and then they make and then of course they get this other one where fever like say the live one, you just fever like that. But all of them are synthesized to one, as you can see. So then they all day in the pipeline and they work on them. Now, obviously, all man they say, well, what make me for taking, not for taking, well, look no more. In America, this one don't they outdated because it's the way I prepare this thing. It have been 22.5 million. Now 23.5 million. Now we don't go up to 30 million. In China, we're the number 2, then 22. Definitely don't go up to 26, 27. In the UK now, look at 7, but we know now up to 17 million today, now the non-taker. But if you watch now, yeah, no African country not there. Now, whether that's a blessing or not, I go left now for alone and make my mind up. But clearly, the world decides say we need this vaccine and we need it now. If we get for survive, for let we come back to normality, we need the vaccine. Without that, we not go forward because waiting do for let people, a population, survive against any kind of sickness, we in one way, one thing the person to the other, we need to get what we call herd immunity. That means 70% or more of that population, they forget protection, forget immunity against the sick. So, because this thing so powerful and until they change itself like Camille, we not get enough time for me to allow people to forget immunity. If not to that, obviously all man go die. Remember, 1918, where we get this kind of thing, this kind of sickness, where we get with a Spanish flu, now 55 million people then die out of 500 million. So 500 million people then get the sick and 55 million people then die. But in that time, when that thing they happen, it take 2 years, now 3 spikes we get 3 times, now in the world get for close down for that thing. So it just goes to show and I say, this thing not to play, a serious thing.
Anyone's going to curse, don't forget that 50.
Okay. Can we meet that, please? Yeah. And so you can see, say, in the UK, we're proud for, say, so far, as I say, 17 million people that don't get their own, the other way, don't take them maybe 3 weeks inside December, or maybe after that, 12 weeks. So man now don't take their own up over 500,000. I think up to 1 million now we don't get that. But look at that. How much people they die a day? 1,001. The one they would inside hospital, of course, now doubled and they case them. In fact, the time when the sick begin, the number of people that we don't die now, they're far more than when the sick begin. So just for telling I say this thing not to play. So if people they deny them, well, now look at this thing and I think for myself. So when person get this sick and they don't better, it takes 21 days or 4 weeks, when they go home, like how my patient, they would then go home, what do they do? Then give them steroids. Yeah, for 10 days, because the steroids, they know say nothing way powerful, nothing way work on the sickness and help people then for recover. Then, because we know say this sick, it affect the chest and it can cause blood clot, then they give them this low molecular weight heparin. So, another LMWH, and that now they do. So 4 weeks, the injection, they put under the belly, and then after that now, the GP them go continue for them, for guide them, After 6 weeks, nowadays, now telephone, now they conduct with clinic. And in fact, as I said, that patient who I tell you now so about, that Pekin, now through the telephone, now then show with the foot, now the socks, now take now that will take no say this Pekin get COVID. So the virtual telephone clinic them can definitely work. And for anybody who don't we get long COVID, after 6 weeks, the GP go phone you for now talk face to face. And if you find out, say, you they suffer, people will be there with the tube, they can actually ask you for coming, for let you come, let them can see you face to face, And of course, after 3 months, So 12 weeks, then go ask you for do a repeat chest X-ray of your chest for see whether the healing don't complete, and if needs be, the final still problem, then they go ask you for a CT scan, because the CT scan can pick up the sick a lot better than the X-ray, the ordinary X-ray. And if they don't give you the answer, then they can ask for let them do this to they call lung function, because people when we get this sick, this long COVID, then definitely they get problem for breathe. Exhaustion, easy. Sometimes somebody they was no more. You just go for, go was, you get there and you go, so you get for patient somebody they go up the stairs and the same thing, you feel weak, unable, so man able grab self side, so you definitely get for check on that. As you see no more, this is what we talk about, then get the one way at the medical management and then get the self-management. So you when at the sick man, you get forgetting way for do. You forget, that pulse oximeter way and when they talk about this now. Check out for see if they up to your level or not, because some man they on 92, now normal landed for them. So if you're normal for you, not a problem. But if you can't down less than 90 or under 80, under the 90, then you get for be worried and do something, especially if you get shortness of breath. Pay attention to your general, health. Remember, eat well, sleep well. If you smoke, think about you get for quit smoking, you get for left the smoking. If you drink too much, well, make sure you cut down the amount with the drink. And of course, you need to think about, then we drink drink coffee, then can't drink the way get caffeine and all that. It might be diet one, but definitely get caffeine in them. So you get to be careful with that. But remember, set targets that you will go for achieve. Let nobody not push you. You know what's needed, your limit, but not give up. And then of course you get the mental side of things. Ways until we will talk about, in another time, but definitely you need the support. You get a link worker where they go appoint for you. You get support group that within the community where we all go there. Get a friend where they call COVID paddy, who now go talk, who now exchange ideas, how this one they cope, how this one they money for do this and all that, which is very important because now that will stimulate you for let you get to side in there, So as I say, it's in the way I talk about this, eat well, sleep well, begin for workers, stay active, and maintain your mental health. Now the big thing that I tell you what, the mental health bombshell within a road, you're not going to even imagine it. I can tell you that for free. It is big, As I say, eat well, where you deceive for yourself, you get the ideal meal, the winner nourishing meal, then you get down the winner snacks, you get down the way get, energy and protein pandem where you go for, but we don't cuisine, we diet definitely rich in that. So we need to continue in that. But with the sleep, remember, we don't talk about this already. Avoid caffeine as best you can. If you're able to drink 1-2 cup coffee that day, during the day, that okay. Alcohol, cut down on that. Avoid for eat heavy meal before you go sleep. If you get for eat heavy meal, make sure say at least 2 hours later, now you go bed. Not go sleep immediately. Take at least 2 hours and get yourself going. Again, we talk about the energy drink them. Avoid that in the day, and no can't turn like that penguin. We go on top of that 6-7 foot wall, then you end up broken in waist. That doesn't help at all. When you get ready for go bed, remember, get a routine so that say when the temperature we hide the heavy, now for go sleep. And remember, say you get for definitely out that light when you reach it. Not go begin put TV, say make I watch this, rather go take we all they do now. We take a smartphone, mobile phone, begin look what's at the last Instagram, what's at the last Twitter, what's at the this and that, and they keep you awake and not begin watch the clock. It not they help you at all. So if you go into the bedroom, now for go sleep, if you're not able to sleep, then maybe go do something for maybe another 20 minutes or so before you come back, unwind, and then go sleep. That way you go sleep well. And if you sleep well, you go for maintain your immune system in strength, keep them up, Remember, you can get music which sometimes go soothing for you, not to them bongoas, soothing one way at least it will make you sleep, As it is, get moving again, stay active, exercise regularly, but begin for develop them slowly but surely, not just sit down at us normal say because they operate the what you call it, the remote control they near you now for this, if you go put the TV on self, no problem. Waka daily, but not exhaust yourself. Know how you tired. The body they tell you, remember say, believe you me, you will get bad days. And if you get bad days, psych yourself for them, prepare yourself for that, because if not to that, they go knock you, and if you knock your confidence down, now in that it's difficult for make you able for motivate yourself and maybe for get yourself going. You know, as I say, connect yourself with people, good friends there. Not to person way they give you that, not to person way pessimistic, person way alternate bad thing they talk about, person way at least be able to lift your mood, you know, lift your spirit. You know, you need to get that sense of stability. Now the only way that you go for beat the sick. You know, so as I say, pace yourself. You know, break the task them to smaller chunks. The way at least you go for achieve. You know, and those one are the best time we go for do that kind of thing. You know, short break, but continue for do what you get for do. And if you they breathe too hard, no push yourself over the limit, but not give up. Be persistent, you know, because the muscle them go get better and the breathing go get better. As long as you continue for do you go increase, you know, your length and your time and your space and your strength, you know. But remember, we get uncertainty. Now, I don't think the mental health, you know, that in a different topic we'll go talk about. But I need for no say, we need for work. We need for prevent, then trigger the thing the way they cause these relapses. People will get depression, you know, people will get anxiety. This thing they cause a lot of problems. Would have done lost work, would have done lost people there. You know, so Monday, you don't know what in this can get for sure. If you get for go do CT scan, you know what in this can go show. You know, waiting at the effect we go get 9 heart, 9 chest, 9 lungs. So man now go begin get this problem with thinking, you know, and a memory. You know, all the things that they cause problems. So we need for begin think about how they deal with the uncertainties, the identity will not guaranteed. You know, so and as I tell you now one thing, nobody not go tell you now say this sickness so it go take now so long it go take. Definitely not. You know, but it's important for let we know say this COVID-19 not to think we na the be all and the end all because we can do the world don't know 7 no more. You know, one day bad like how this one bad. You know, we don't get other sickness. And believe you me, people only talk about malaria, but the most lethal illness in the world, not malaria. I don't know how most people know about that, but malaria, they kill like nothing else. So COVID in kill one, if you think about malaria, you know, they even compare them. But it just give you that reassurance, say, we can beat this thing together. But the only way for do it, now for let we able for join arms together and try for think for able for go get this vaccine. You know, and person can say the long COVID, naturally they pass from one person to another, not to say bill. No, at all not. So the NHS, as we know, I'm the one with the England now, he give you 3 keys when a recommendation for where we continue for main yourself. One for pace yourself as we talk about, and plan you day them, and of course prioritize. You get for give priority to which you think say nothing we for do now rather than put them off. You know, so finally, make I tell you, I say, Leone, I recognize say, this thing they not to play long COVID, nothing with it. If you see we patient just the way they talk to Mrs. Binks, talk and play one, nothing way dangerous is serious. So remember, we deal with something we will not know much about. This thing now 1 year no more it don't take. So we don't know much about. Every day we learn new things. Then you understand? We don't be no say this thing will affect the food and then picking them. We don't be no say it will affect them. It cause the system them for breakdown like this Kawasaki syndrome. In fact, the man self died last year. The man we now get this. We discovered this illness by them picking them. You know, but of course, the most important thing is we see say information overload there, and that not the help way at all because we own companies go begin talk about this. I need to take this because I not trust this. I know this and that. They'll go interfere with my DNA. They'll go cause me enough for bond picking and this and that. Imagine somebody done 70, he still think about bond picking. I don't understand that. But anyway, all mandate to you. You know, we all they learn from each other. As I say, if you get that COVID paddy, we don't call COVID body, it go help you. But please, please, please remember, not suffer in silence. We all there for help you. We're not there for take you GP in place, but obviously if you talk to we in confidence, we will definitely help you and guide you how to go. But remember, stick to the government in guidelines and remember, say, you not for suffer in silence. So I thank you now and I go happy for take the question.
Thank you very much, Uncle Doc. Wow. I feel sorry for you, but I don't say they enjoy. Oh. You know, I don't say you enjoy the show. So I don't feel sorry for you much.
Thank you.
But thank you very much for the session. If I'm I hope say we all don't listen to it, Uncle Doc don't see Dr. Kamal don't see. And I believe say Boku of we will get a
Don't
lot.
give the residents
Yeah, let we meet yourself first. If you not get question for us, yeah, the big let me meet yourself. I believe say most of we don't learn a lot from what Dr. Kamar don't see. And to Anne, thank you very, very much. We really do appreciate you coming on board to share your experiences with our community. We really do appreciate you.
And Mr. Binks.
And sorry?
Anne and husband.
Ah, thank you very much. You're welcome. You're welcome on board, sir. Thank you very much for joining us. The Sierra Leone community, we are very friendly. So hopefully, when all this, chaos is over, at least one day when we're having a community event, you're very much welcome to join us. So at least we can meet in person. Hopefully that will not be too far in the future. Auntie Victoria is going to be the first person to ask questions. Yes, Auntie Vic. Auntie Vic.
Yes,
Yes,
I can hear you. Yeah, okay.
Yes,
Little bro, thank you very much for that information. My question I want to ask is, how we go able to persuade the people for take this vaccine? Because my company where they work for, we don't, especially in London, we don't try so much in the difficult to get African staff for take this vaccine. Whereas in the Taba Hamlet area, where the Imam then go to mosque, all the Muslim staff then don't take the vaccine. For African staff, they will get problem for them to take this vaccine. How we go able to persuade them?
Thank you so much, Big Sis, for this question. In fact, you just don't see the answer by doing what you do. So, as I say, I attend the one that leads this afternoon. We the same thing we talk about. We were at the health sector, we were at the medics them. Now we know for relent. Now we for actually try for convince with people and say, look, I tell you what, this sick. If you sometimes you get well body, catch them. That not mean say you get them more because sometimes say you get anybody. But the one thing where you know what now you mind, now for let you pass them on to your own person where you like. And that is the message. Because you can be young, but you get a very good immune system, you protect yourself and all that. But if you get them and you don't know what they call subclinical, you can actually pass it on to other person. Now that you want my mind, I doubt very much you want that in my mind. Besides that, as the world day, nothing ways on time, nobody no go on for you. But I can tell you that this Saudi Arabia, don't say anybody will not get them two vaccines and they need to go to the country for go to Umrah. And as I talk about now, it's possible say we they get to that stage where it be say the aeroplane them, they not go take nobody on board where they know say this person not get that vaccine. You imagine what would they go free tongue? We were there, now this part of the world, we say let go free tongue. You can't board the plane if you don't get that yellow book. No, so that yellow passport, you get for go yellow fever, dengue, hepatitis B, typhoid. If you don't take them, they're not gonna make you board. No, so.
No.
So that's the problem we get. Now, this is the message we get for tell people and say, I tell you what, we are all in this thing together. We need for try for EPUSEF. Because if me not get them, I know say I get them. That no means say I don't get them more. I make him pass it on to you, but I don't want for feel. I make you see we all wear the mask. If you come to me in the hospital, I go wear my mask because I don't want for pass on to you. And likewise, you say for wearing mask and not pass them on to me. Now that's not the message. But the only way we go beat this thing for let get 70% protection, now for take the vaccine. If we not take the vaccine, we can't guarantee, say, like how this thing they change itself. So, so you go control yourself against one. But now we don't get not to 9, 10. Who knows what thing will happen in the future? You understand? Now make you see today will not get the flu vaccine in own permanent one. Because if we can do the same virus, then that mRNA virus is so clever. They change from blue to red to white to green. And you can't be keeping with that. You can't keep up with that changes then. Therefore, the only thing you go for do, now for try for take this vaccine. Take them and see what you feel. As I say, people like talk say the side effects and this and that. Well, so far the side effects when we know, sometimes somebody go on for tell you about them. But me, when me take them, I get pain in my muscle way outside and give the injection. The place red. But other than that, I'm not getting nothing. Some man go say you get tornado. Some man go say you begin feel bad. You just lay down, feel dizzy, and all that. But then they pass after 3-4 days, and then you get well, But remember, I said they still continue for surveillance all the effects the way people in the report when they take this vaccine. But I think say we know for relent, we need for continue, we need for be consistent, and we need that stability for make we go forward. I don't know if that's helpful.
Oh, that's helpful. Thank you.
Thank you.
Thank you very much, Uncle Doc. Auntie Sarah, I will come to you. I don't see you. And dear me family, if you want to ask question, the tool gets a function where you can press for issue and up. But if you not sabi use them, please feel free for issue and up physically. If I see you say you want to ask question, I will go to you. Dear, I beg me family. If I don't see you and up, it not means I ignore you. It just means maybe I see you. But when I see first, I will go to. What I want to say, okay, to say I don't put your hand on. I don't know if you ask question. And what I want to say now regarding this,
Yeah,
oh, you are still up. Yes, ma'am.
Yeah.
Go ahead, man. Go ahead.
Okay.
Sorry.
Yeah, Doc, what I was asking, are they working at the educational sector? And I want to know, because the government in plan, in roadmap or whatever is that by the 8th of April, all schools supposed to be open. I want to know though, as a citizen, can I request for the injection, for the vaccination from my GP? Do I have that right to request it? Because I'm a bit skeptical going to school without the vaccination. So what's your advice?
I'm sure you could request that from the GP. Now, whether it would be available, maybe because of your age or maybe because of your profession, I can't guarantee that. And besides that, the GP practices do have different variants or different, vaccines. Some may have Pfizer, some may have AstraZeneca. In my trust in what I am, luckily, I actually wasn't going to take the Pfizer one. I told them that because the recommendation from the manufacturer is a 3 weeks lag period. So I said, well, if you're telling me 12 weeks, I'm not going to take it. Simple as that, because there's no data that actually confirms whether the immunity that you develop after the first injection and 4 times the lag period later, that the immunity stays the same, whether it's dropped or not to maybe 0. And then by the time you get the second one after 12 weeks, it might just come to a certain level. Nothing like that exists. So therefore, I'm not taking that risk. But when I found out that the AstraZeneca one, in terms of logistics, in terms of transportation, in terms of storage and all that, it was far easier and far more amenable to my needs. I opted for it, and luckily the trust offered that to me. So I think what they're doing is they're going from the most vulnerable groups, i.e. the 80s and above, and then working their way down towards the one. But apart from that, the ones in the front line obviously would have to be given preference or priority, not because they're more handsome or beautiful. It's more to do with the fact that they are
I think teachers are in the front line as well, isn't it?
Yeah, no,
well, that's not your decision, but I don't see why I should go and teach.
I think that's what we're working towards. That's what we want the government to actually accede to. But what the government is doing, they don't want to be data driven. They want to be data driven rather than date driven. So if you're talking about the April, that is still up in the air. It's not confirmed. If the outbreak or the R number is not coming down, I guarantee you they will actually extend the lockdown. And that is why Wisconsin is not committing himself to any date. He's actually saying, I tell you what, I need to be driven by the data. So the R number, thankfully, for the first time since July, has actually gone down below 1, which is a good thing. We are grateful for the vaccine. I can see my colleague, Dr. Sise maybe wants to say something. Thank you so much.
Dr. Sise and Dr. Krio as well. So, Auntie, you go first. Dr. Sise, you go first, then Dr. Krio, you will come after, please.
Okay, sorry, all the hearing me. Sorry.
Yeah, welcome
I
back.
don't get me video today because
as long as I hear the voice, I make
but the question where Auntie just asked about the teacher them, yes, we all get that sympathy for the teacher them because the picking them, then they give people then the virus and they picking them all okay, alhamdulillah, But what I know say the research and the petition now for the teacher them forget the vaccine because it's true. Technically on the front line, but like Uncle Dr. Kamar don't talk say we don't get the definitive answer. So until we get that answer, the government they go down the list of the priority. The other thing where I've been wanting to say about the GP, I only did talk this thing because at the moment, genuinely, we inundated with beaucoup telephone calls and beaucoup people they ask me, who's there I go get me vaccine, who's them, but not to we the plan and in the government, okay? So what in the government, na the gov.uk website, all the inside there, all the information there, all we go able to tell you now what in there na that website. So I know this they no call you GP, but like you, not only what in there na the website, what in the government don't talk in that then we sabi. We don't get no control over whether they get the vaccine. We just they follow the guidelines. I don't know I want to say for now.
Thank you very much, Dr. Sisi.
Thank
Welcome
you.
back. I'm glad for your voice. Dr. Ture, yes, sir. Dr. Peter Ture? Dr. Peter Ture?
He muted. Tell him say he muted.
Yeah, I try for unmute him. Unmute yourself, please, sir.
Okay, I don't do so now because I think you me.
Yeah, I can hear you now, sir.
Right. Bona, thanks very much for conduct this presentation and for try for raise awareness on this issue. Of course, we're all aware, but the efforts on the make right now for throw more light on the COVID is well appreciated. And I must commend you all for this. Well done. And thank you so much, Mohammed, Dr. Kamara, for the wonderful presentation. Now, I get one thing really bothers me, really actually boggled me up, because you just not explain to we all now so about all the variants already. And as you rightly mentioned, the CC, they decrease, it just they increase. Every country like that's almost getting on. I think the evidence is clear. But now the question is, given the fact that we get so many variants, how we will be sure of what type of the vaccines that we will still work on the COVID we get in a given area? How can this be addressed?
Super. Thank you so much. A valid question, and it's very important. And I think we people in the ask, well, hang on, the new this the way they turn Camille Panwi up and down and all that. It's absolutely superb. The difficulty is, all the virus then get one particular makeup. And so if the vaccine where they take, they actually affect, and stop them, if you, I don't know if I go to get down there or, just for show you how the thing they work. It actually will walk towards the, if I can show you, right. So if you look at them, you go see say.
Sorry, Uncle Doc, you need a display.
All right, okay. Just want to see if I go forget them. Oh man, I just want to show them how it is.
Yeah, if you share his screen, you will see them.
Did you see them?
No, when they share it too, you not share his screen.
Okay, let me share then. Yeah, that's it. So that's how it works. That's how the vaccine they work. If you watch them, so if you see the vaccine a weak one or one way and a dead one, then they introduce to the body. So when you introduce them, this thing they trigger a kind of response. It's like when somebody you scan for can't you. If you use the front door, then get wind that the way they can go through, then get the back door, like me we get conservatory, you get the door them, two French door them, so they can use any of that. So if you get the vaccine, you block the front door, and you find out, say, the find them kind of the other side. Well, I tell you what, if you not get nothing at all for block this one will the new one, the bottom bit, at least then they go protect them, and then they go give you enough strength for get this thing up, we go actually pull this sick about anybody. I don't know if I didn't make any sense.
Yes, they make sense to me. But again, when we talk about variants, it means something they were different than their own.
Yeah.
So therefore, if the vaccine they work, if I understand you well, it affects any specific virus based on immune properties the way before say get. Then if you don't get that virus now in a different form, then means there's something the way before say the vaccine not able to address.
Yeah.
If I put them in common language.
Now,
Yes.
yeah.
So now how are we able now for identify which vaccine they affect or they work effectively against a particular type, and how we know which type?
Okay. So we don't know one way, we don't deal with it for the whole year. And then they work towards, right? So now, as I say, the virus makeup is not different from one to the from the other. They all get the same makeup. The only difference is that they get specific, like a spike, then change them.
Yes.
This one then
yes, the spike protein, yes.
So that no means all the other bit no will get, destroyed. So as I say, if you're able to get enough army for actually block yourself from this, and this one day, obviously, you get a better chance for Fred than when you don't get nothing at all. That's not one thing. Besides that, the government, they're all now, the researchers, the people that really work on this thing, they work towards one top-up vaccine we will come in the summer where they address the new variant. That's not the work we're now.
Okay. Thank you so much. That's quite good. I appreciate the explanation we give.
Thank you.
Yeah, thank you so much.
Yeah.
Thank you very much, Dr. Kamara. I've been seeing Auntie Aziz and Andy up. I don't know if you want chip in.
I see Patrick Dixon.
Yeah, we'll come to Mr. Patrick. Well, Aziz and Andy.
It's okay. Uncle Dr. Kamara answered it. Thank you.
Okay. Thank you very much, Aziza. Mr. Patrick Dixon, if you unmute yourself, please, sir. Thank you.
Yeah, good evening all, and thank you, Dr. Kamara, for your wonderful presentation. My question is just a simple one. Of the two most prominent vaccines, the Pfizer one and the AstraZeneca one, can you choose which one you would like to have? Do we have that choice?
I think I answered this question, Sepi. I answered this question because of the fact, I think the lady asked a similar question and I answered it. Now here you are, that's it. These are the four that...
No, Uncle Doc, you get for display, you get for share your screen, please.
Okay, let me do this again.
Thank you.
Right. Okay, here we go. Where is it now? There you go. So these four, you see them, the AstraZeneca, the Moderna, the Pfizer, and the Sputnik one. These are the ones that are very popular. As I said, there's two more, which the Johnson & Johnson one and the Novavax, which has not been approved yet. Now, it depends on the locality where you are. It depends on the GP practice that you are. For me, as I said, I was just a lucky person that my trust offered both of them. It said, if you're not happy taking the Pfizer, the AstraZeneca, and I opted to take the AstraZeneca. Remember, there's a budget that is given to the GPs, and they then have to get like a batch, which they have to use in a certain period of time. For example, the Pfizer one, as you can see, is stored at temperatures of -60, 70, and above. So for you to actually utilize those, you have to actually think about the logistics, transportation, how many issues you face in terms of transporting them when you have the weather conditions being as harsh as they are. And compare that to what you have here. This AstraZeneca one, which is stored, if you like, or kept in the fridge on the regular temperature. That's why I say this is the preferred choice, because this one doesn't have an expiration or maybe use by date. This one you have to use within 5-6 days of actually thawing that batch. So if you've got a batch of 1,000 and you haven't managed to use half of that, which is sometimes the case, you've got to dispose of it, because obviously it then becomes rather dangerous and useless. So it all depends on the GP practice. It depends on the locality where you are, and of course the availability of maybe one or two in one area. But whether you'll have to choose is a difficult question to answer, because I'm not sure what the GP practice that you're in or you're under is offering. Does that answer?
Thank you.
Okay.
Thank you.
Yeah.
Thank you very much, Mr. Dixon. The next person I get, Fauzia Hadi.
Yeah.
Unmute yourself, please.
Yeah, Dr. Hadi, welcome.
Unmute yourself, please.
Yes, Dr. Kamara.
Ladies and gentlemen,
Yes, I saw you at our.
in Leeds.
Say that again.
Leeds. Yeah, she was one of the presenters. Thank you so much for joining us.
You're very welcome. Yes, I just want to say, I think it was Patrick Dixon who asked the question just now about the vaccines.
Yeah.
You cannot choose. I mean, Dr. Kamara, I'm really surprised that, you had the option to choose. As you say, probably the locality that where your GP is, maybe they had surplus vaccines that they didn't want to throw away. But really, you're not allowed to choose, They're not going to mix them. So if you have your first dose, it will be Pfizer, second dose Pfizer, simply because they haven't done trials yet to know whether both vaccine, whether you can have one as Pfizer and the other, say, as AstraZeneca, because they don't know whether they work. But I work as a GP in Leeds, and what we don't give people the choice at all. They just come in, we give them what we have to give them, and that's it. But then our where vaccines are given in our locality is a really, really big practice. So lots of people come there, and whatever the vaccines are used up. So we don't have that sort of option to say, oh, you can choose. So as you were telling Mr. Dixon, it is what your locality is doing and how many vaccines they've got, so that they don't want to throw anything away, because that has been in the news that GP practices are throwing away vaccines, and they do not want to do that. So you really won't have a choice.
Thank you for that.
Thank you very much, Doc. Yes, Dr. Toure, Peter Toure, please, sir. Yes, come in.
Yes, so thanks very much for Una to give me this privilege to make an address Una back again. This is not a question. Now, just information I just want to share with Una. And the reason being that now closely related issues them. What you want to talk about, so COVID. Dr. Kumara Fuling will say now one of the type of diseases that we didn't call zoonotics, right? So now a disease way before say it arises as a result of what? The actions and we mortal man they take against real biodiversity, and the reaction of the biodiversity now end on bring about this type of disease. Now, my own background, agriculturist, and I specialize on climate change as one of my interest areas. We've been able to discuss this issue in various meetings, even at the UNFCCC level, in global summits. And we know, there are more coming. I know the flight to now. COVID is just the beginning, but we get forget more. And I feel, Dr. Kumar, then go agree with me. Right. So, in line with that, I've been a champion one particular cause for Salone, because we didn't get Ebola start from Salone, not so, which is, of course, is a virus, right? Now, we get this climate change issue, and there is a link between then diseases and climate change. Now, because we look at climate change, we did decide now for escalate this issue so as for sensitize people, let them become aware of what, of course, not aware, but then the climate procedure or the climate process is very complex. And until people then raise their voices them at all levels, they're not going to take Una serious at all. So therefore, I believe, if we join forces with Una for try for sensitize people, even here in the diaspora, for make them know exactly what they go on our own country alone. And some of the problems that we say they create for ourselves. I believe, we must take positive action. I'm sure one of the year complaints currently about deforestation alone. It is getting to a very, very critical point. Make I inform on this forum, yes. Deforestation is a serious issue. now a big driver of climate change. And people unabatedly, they abuse with biodiversity, most especially with forests, not alone. And if we sit down, we don't do nothing about that, already it don't become critical. So therefore, we need to talk about these issues and call government, invite government to a table for make them know serious we get concerned. I feel say it worth a while for make I inform about this at this meeting here. So, and at a point later on, we will want for link up with her for make we go hold on dialogues then, either with amongst ourselves also, or with other parties then we get interest in this. I hope soon I will look into this in the near future and we can draw out a roadmap on how to go about it.
Wow. Thank you very much for your advice and also for the insight where you don't give into waiting the happen. Some of we know, some of we, at the first industry area. We be share, we email at the beginning. If you've not been there, hopefully before the show end, I will share the email as well. If you reach out to we always open for have, as long as there's something for do with people then well body. That's something where we always happy, for engage with anybody for a lot of time for see how okay we benefit with people. Dr. Kama, again, anything for saying on that, sir?
Yeah, brilliant. I think we'll be talk about external speakers. I think probably we don't find one. We'll talk about this impact of these zones them as is, this man, although an agriculturist, but I get every faith say, then seek here, just like I talk about now, we mortal man, they go friend, then tear them plabber. Now I make you see the fire up and whistle. You know what I mean? So perhaps we can think about a topic we link to that and the sick them way, them virus here, them bacteria, they cause waste until you go for presenting. So we go look into this. If you don't get any objection to that, I think say Ingo probably be willing for can talk to we, like how would you do it? So over to you, Dr. P.
Okay then. So well, thank you so much, ladies and gentlemen, for our effort for address this very serious problem we don't get. It's a very serious one because we don't get a final answer it. And just as Dr. Kamara just tell me just now, that we now look at the time frame of 10 years, not so?
Yeah.
10 years, well, that is serious. Now, against that background, me tell on I'll say, as a result of climate change, it will be worse than that. There are more way on the road, not to prophesy, but these are just some of the consequences that we will anticipate. And the sooner we begin to take actions against them, the better for we all. So I thank you very much for this effort they make.
Thank you very much, sir.
Thank you so much.
You're welcome. Yeah.
Okay. Thank you very much, Dr. Peter Tigre. Like I said no more, I guess Uncle Doc know you, so we'll find a way for hopefully one power session that we'll invite you as a guest. We'll be able to talk more on the issues there where you don't highlight, because there's a lot of practices there where we can able change a salon, parts of Africa and also around the world, we go make we picking and live a better life. So by God power, we go find a way for low touch base and try for arrange something in the future. Dr. Kamara, somebody asked a question. I know if you don't answer this before, but maybe the person miss some. It say if you know of the worst case scenario, like very adverse effect where somebody don't take the jab, either it suffer as a reaction, it suffer paralysis or death. Like I said, if you don't talk about this already, but maybe the person miss some. Yeah, for the benefit of that person, that you want highlight this again as to the side effects of any of them vaccines here.
You see, when they do the vaccines, as I say again, if I able to share, I'm not too sure, but the vaccines, them the way that they do then they go through the phases. Them, I don't know if I will get them. Let's see. There we go. So that's the thing with it. Now, so then they do them. You see the all man they grumble, so we to make this thing now within 12 months to don't get down, whereas the other one then go they up to so many years. That's the thing. Even though we don't go through the animal phase, we can't do the first one when just a few volunteers. Then from there, if nothing bad no happen, we go on to the phase 2 where a few hundreds will come and then still continue for monitoring. And if nothing bad no happen, then we can go on to the thousands where you can then volunteer for do that. Nothing mandatory, just voluntary. From there on, if nothing happening after that period of observation, of course, they'll get the seal of approval. Now, with that seal of approval, and then go give the manufacturer the nod, they go ahead for making able for begin produce that year. But look at that, manufacturer and post-marketing surveillance. So the surveillance, they continue, they not stop there. So if you remember, they told them in the Fed forget this vaccine, at some point they stop the trial, because waiting to then find out, say, one person pandemic get a bad effect, therefore then get for study that in the and find out with anything. So anybody we involved per medicine, then they tell you plain one say, this still not stop now. Because believe it or not, I don't see somebody we're allergic to paracetamol. Of all products, paracetamol, this person allergic to them. But guess what? If this person take cocodamol, nothing is wrong with them. But if you take paracetamol on your own, in face this well. Yeah? You take codeine, in face this well. But if you take paracetamol on your own, in face this well. Whereas if you take cocodamol, nothing is wrong. So all the things are nothing the way that they record, then continue for monitor them. So if somebody die, me understand them is that you need for actually understand, say, the coroner then they for do 4 questions now the coroner day for. So who died, when then die, who side then die, and how then die. So the how now get the inquest. So if somebody died because of medication we then get them, especially like a vaccine, when a new one like that, then go definitely get for investigate, then go do conduct a postmortem. And then from there, then we'll find out whether the cause of death. Because the thing is, we easy for little point finger say this one, but one thing we don't know is that so this person we don't get a heart attack, we don't know about. So this person get myocarditis, we don't know about. So the heart big, you know, so the person get cancer way on the line, where nothing that this injection then can bring them up. So it's a difficult one, and just like that, I don't think say I go commit myself for beginning comment. But one thing I know is that the vaccine them then safe, because then they go through some rigorous test them, stringent test them. In fact, the way UK been there under the EU, each and every member country of the 28 member state them, they conduct their own very meticulous test them. And each one point they get for approved before any member state actually approve the use of any vaccine. Now make you see, we the doctor them, they always advise you for go according to waiting nice guidelines there. You know, when at the Institute of Care and Health, you know, and of course, if you not do that, now you go prescribe something we're not doing that British National Formulary, that Bible, what we call a Bible, you know, the medical Bible, and something happened to the patient, you're in trouble. So that's what we do. So I can't comment on waiting, say somebody die because it take COVID. I think say there's a lot more for answer before I say yes, that 9 killer. But so far, 17 million people don't take them, and I don't think say they don't record one fatality yet. I hope so that's helpful.
I hope so, sir. Thank you very much, Dr. Kama. The next person who gets now the chairman for the SLOGM Organization of Greater Manchester, Mr. Joseph Kaloko, sir.
Thank you, Mr. Piero.
Yeah, can't tell me how you feel where you
no, this not to question. I mean, question what I get, all man don't ask them, so the needless for them to repeat yourself. I mean, I just want to say thank you to Dr. Kamara. They do a fantastic job, you know, for bringing this to the community, but especially Akaya for can say thank you to Anne and the husband for come and share the, you know, experience with us as a community. But like what no, in English. I think I have to say that in English. Yeah.
Oh, Kaloko, yeah, see I'm in English, so Anne go understand.
Yeah, and this is your chairman for the Leone Organization of Greater Manchester. My job is to provide leadership to the community. I really appreciate your time taken to come here and share your experience with us as a community. So like as my PRO, who is the current host of this program, said to you before, maybe our next session, I would like to invite you to come on board with the husband at the same time and maybe meet us in person and have a good time. Thanks so much. I really appreciate that. Thank you.
Thank you very much, Mr. Chairman. The next person really on the JT. JT,
Yes,
please.
yes, thank you very much, sir. Thank you very much, sir.
Welcome, sir.
I just want to say thank you very much, because it's really good. Education is power, it's power for us to learn more. My only question, I think I've got two questions to ask, Doctor. First of all, is it right for us to say that we are still in the trial stages for this vaccine? Is it right to say that? Or are we saying that we find it's confirmed and everything, or the people that are even having these vaccines now is still, because we still need to have more knowledge how it's going to react, on people? And secondly, has there been any cases, concerning people that have got sickle cell anemia or sickle cell trait? Is there any, allergies to that? Thank you.
Thank you very much, JT. Yeah, that'll come on.
Thank you so much for that question, or the two questions. In fact, I think there are learned colleagues here as well, who are GPs and who are doctors. I think they'll bear me witness to say that there's nothing that I know, and I stand corrected, to be, if you like, a contraindication for somebody who's got a sickle cell trait to actually receive or get the vaccine administered. I don't think that's a contraindication at all. In fact, the trait is one thing, but the person who's got the full-blown sickle cell will probably belong to the vulnerable group. Therefore, I'd strongly advise for that person to actually try and endeavor to ensure that this vaccine is a must for them. They actually take it as soon as possible, because that would help protect them. Remember, they have got a weak immune system, and therefore they are prone to catching illnesses that otherwise would have been something of a bit of a sail through. So therefore, I strongly urge them to take this vaccine and as soon as possible, as soon as the opportunity presents itself, please take it. Now, I don't think we're at the trial stages. The ones that are at the trial stages are the ones that haven't quite met with the demands, the rigorous demands yet. But as long as the vaccine has been approved, it means it's gone past the trial stage. And once it's approved, it's now then put to use, if you like. But that said, there is continuous surveillance, on what the side effects are and how it progresses. As I say, we're still working. As I told you, there is the one that they're working on now, and hopefully in the autumn, you get the one-shot top-up, just like we have with the flu, that you have it once a year. As you get to the autumn, you then need a top-up, which is something we'll be having. And as we know, this flu virus is in the same family as the COVID-19 virus. So we're taking the flu vaccine on an annual basis, and I see no reason why this should be different. So that's the way it is, really. And I'm not sure whether my answers are up to your expectation.
Yeah, thank you very much. I think what my fear is a little bit that, because when we know about other vaccines, they've kind of took about 2-3 years to actually develop, and some people are actually worried that this was very, very quick.
Sorry, sir. I'm
muted.
Yeah, I mistakenly mute you.
I think this is a question that I answered already. I think I showed you how it is they've arrived. If you want me to show it again, I can do that. But I think how they arrived at this, the rapidity of producing this vaccine is because they took away all the red tape, all the bureaucracy, and it was a situation whereby it was a dire need. The world needed something that would actually stop us up, that would keep up. As I say, in 1918, there was no potent vaccine, and 55 million people lost their lives. And as I said, there was 3 spikes. There were 3 spikes of the illness. Remember that. It lasted for 2 years. And I can tell you, that particular virus wasn't as clever as this one. This one, we know about 8 to 10 variants already. And we're grappling with just one of the vaccines, never mind the fact that we're actually looking at maybe changing it towards the autumn. So you've got to realize that the money was pumped in. Even just for the Pfizer, there was over 40 million pounds that were pumped into this. And the whole world were doing this thing at the same time. South Africa, Sweden, Germany, America. All these guys were collating the evidence as they were doing the trials and the research. And so therefore, they had to do it in record timing. In case, as I say, you're not aware, I said it, during the Ebola outbreak, between 2014 and 2016, there were 2 vaccines that were developed. A lot of people don't know about this. But it took 60 years for the polio. And because of the vaccine, we're saving 3 million people a year. We've got vaccines for 20 illnesses. Yeah, so it is a bonus. And as I said, when we achieve herd immunity, which is the 70% of the population and more, we can then probably begin to rest. The fact of the matter is we can't achieve that on our own. We need help, and the help is a potent vaccine, which we have in these. I hope that's clear.
Mr. Gentri?
Yes, thank you very much, sir. Yes, because that's what is actually a little bit difficult for most people, because most people that have studied about vaccines say that this one was quite quick, and is it now that they're actually going to wait to see what will be the reaction in the next 1 to 2 years to know actually what is going to happen, whether it's actually working on people or is having different side effects. So those are some of the reasons why some people are a bit afraid, but probably if they have more assurance, that will, curtail a lot of, scaremongering or whatever. So I think, yeah. Thank you.
As I said, I told you of the 6 vaccines that we do have. If you want me to, I can share the same slides. The 6 vaccines we have, 100% avoidance of fatality. Does that tell you anything?
Yeah,
100% of the people who've had the 2 shots of all the 6 vaccines, including the one that is still, in the making, the Novavax, none of them have died. Now that, for me, is enough proof to say that this thing is efficacious, this thing is working, it's saving lives, like I said.
Is it not the time frame a little bit quicker to this?
I beg to differ. As I say, the MMR vaccine that we use in our kids, we use that two shots of that, and not at the same time. It works for the kids. And I remember there was a colleague of mine, I hasten to add, who was a pediatrician, who then decided to tell the population that, look, if you took the MMR vaccine, all the 3 of them at one go, your child is possibly likely to develop autism. And I tell you what, because that was scaremongering, as you put it, most of the parents decided to sort of heed that advice. And in the end, what happened is we have this massive outbreak, especially in Manchester here, of measles. And I tell you what, a lot of kids suffered because of that. So what we need to be mindful of is that we, the BAME community, the Black and ethnic minority, are the ones who are disproportionately affected by this illness. Yeah. So therefore, we should be in the front line. This is the only time I can tell our people to be very, very selfish. Put yourself number 1. Look after number 1 before number 1, the coffin, looks after you.
Thank you very much, Dr. Kamara. Sisi, I'll come to you. Mr. Asise, I'll come to you as well. The thing is waiting at the panel, so I'll come to you now. The problem is the people at the public want to know. The family, Dr. Sise, you can say something. The also now the doctor will be show a picture before. I say I'm not sure if you could join me, so you can say something back to me. Auntie Aziza, Dr. Sise.
Yes, I do. I just want to compliment what Dr. Kamara said, because the thing where I'm so sorry, I forget your name. The question and the subject where you don't say Boku people and they say the same thing. What you make this vaccine, they will get quick. And like Dr. Kamara said, we get Boku in them. One, technology don't change. Whereas before, we not been get all the technological advances where they now. Now that make one of the reasons why I make the vaccine don't come quick. The other thing, money. All in the world they suffer. The money that they pull all side, the aviation industry and so on. So all side they pour beaucoup money for this vaccine, and then the big factor why make other vaccine they take time. The other thing where they the new vaccine where the mRNA vaccine, that one it already exists. They may already do all the research for that one day. You know, say this coronavirus, you know, new, we get Boku coronavirus we've been there before. So they do different research for years. So when this one don't come, they already been on get the technology. So the other thing where help, what they get for again are the sequence of how the virus turn. Okay, that one can take years before people then be able to get them. Now, the China, I think within 1 or 2 months they don't get the sequence of the virus. So that make it expedite the make for the vaccine. So all them thing them they now that make the process quick. Oh, the other thing, volunteers, because this vaccine, this virus already affect the whole world. Beaucoup people volunteer for take the vaccine in the trial period. So again, they're not short for game money. They're not short for the technology. They're not short for the people. Them now that make the vaccine it can quick. The other thing where I want to say now this, we all been dey pray for medicine for can quick for this virus. We all been dey pray with mama there, with papa. They all say, "Hey God, make medicine come." It don't come. Why make we afraid? You know, things don't change now. They know they do they like before where they go experiment illegally. Now there's so much regulations where they before they go pull out that door. So I just want to reassure all man say beaucoup research on the pan this thing and the research is ongoing. And we pray say yes, we know Sabi what's in the long-term effect. But we did pray say for now, we know say the short term of not they get the vaccine, but could lives go lost. But if people don't get the vaccine, we know say for now, hopefully, what we don't see Uncle Dr. Kamara don't talk say, but could people will get the vaccine, no one they die. So pros and cons. I hope
Thank you very much, Dr. Sisi. Me family, as na Uncle Dr. Kamara don't say, he didn't explain that to we. And Aziza himself, Dr. Sisi said don't come, he don't wait for say, but rest within Dr. Kamara don't say, he didn't explain exactly waiting how this whole thing, how they don't waiting go through for them develop their vaccine there. And which are the process they wait in place for make sure say then the monitor waiting they happen. And why make we get the vaccine also develop so quick? And at the end of the day, as we all know, we all don't get locked up now. We all don't be in prison for over a year.
Indeed.
Yeah, it's coming to a year now. We don't get locked up. Picking in school don't well. At the end of the day, that 1 year they will don't pass. So no matter how much they teach them, say that 1 year they don't lose her. But Kuma don't lost job. How many companies they don't close? And they say money important over life. That's not what I'm saying. I would say no more that we all be pray to God say some kind of medicine come out. Now we don't get something. And like we say no more. The world where we live in these days, day like I've been there before where somebody go make kujumuku, go do something at corner. Now everybody aware, even people in back home, they're all aware. They need to go take somebody no more say, Kala, put this by you. They ask you, the first way they ask you, now waiting Andy. Waiting for do to Musa Ipula. All the question and they so it's not that easy for somebody pass something more being back though. Obviously, we're not we're curious, we want to know, and giving as well, waiting to happen in the past and stuff like that. It's natural. We will ask questions. Not to say when they say for people to ask questions, it is natural. We get for ask questions, and it's good that we ask questions. The only thing no more, let you know follow some of the things that we not get evidence for backup. I'm not saying now we all don't turn scientists, we all don't turn doctors because we go on Google, we see something. But some of them people are where they write some of them here. Me and you not sabi them. We don't even know maybe that they number one and you keep for go take the vaccine, but then go tell you say you not take her. So for me, I go say everybody get for make your own informed decision. Stuff there online. Fair enough. The internet today. Stuff there on radio, stuff there on TV. But program down there as well, we all dinner so for we try for help. Like I say, me not a medical doctor. So Mrs. said the land just like I own all the land. But I wait for we get knowledge, not go make that informed decision. So at the end, we made that decision, say, okay. I made a decision based on me belief. I don't learn, I don't hear, and I convince you, which I hear about for do, you know, something will benefit me. Okay, and then make what they do this. Not to say we force anybody or whatever like that, but they try for give as much education, as much awareness. You know, say una go sit in your own corner and say, well, this good for me or this not good for me. Okay, Mr. Patrick Dixon, sir.
Timon.
Yes, sir.
I don't know if he's still there with me, Ethan.
Yes, I'm still with you guys. And thank you once again.
I'm thinking of Ethan Harris. His hand was up, I think. I don't know if he's still with us.
Ethan Harris.
Yes, I am.
Please.
Yes, I am. Yeah. The comments I've been wanting to make now with regards the length of vaccine production, but the other doctor.
Sorry, Doc, sorry. I need to introduce you. Right. Right, ladies and gentlemen, this is my new brother, you know, as P-Man and myself, your brother, you know, we go a long way back, but he's a GP, so probably, you know, well equipped for say something to me. So thank you so much for joining me, Doc.
Thank you very much, Mohammed. Thanks. I'm really impressed by this forum, yeah. My comment will be one for making have been to Mr. Thorpe in question with regards the length of vaccine production. But I think say the other GP don't adequately answer them because it was A, the funding, money day, so people in because money day you pump the money. B was the number of volunteers available because you know normally they do research, then they do clinical trials, and for the clinical trials you go for find the number of volunteers. There was an ample pool of volunteers, so you're not going to begin strain. The other thing as well, as whilst the vaccine was being researched, the pharmaceutical companies, they may already they do the basics of the production. So they know they begin start from zero when you get to the point where the vaccine approval don't take place by the ethics committee. So as a result, all of them and they shorten the amount of bureaucracy with they along the process. Now that's make you get the vaccine being produced in 8 to 10 months as opposed to 2 to 3 years. And now because this is a pandemic as opposed to something that affect only a small number of people, this all man involved, so all man want to lay down quick. So now that's the advantage and the way we get. Unfortunately, if we been get the kind of same thing for like malaria before don't done by now. But thank you very much.
Thank you very much, Dr. Harris. My family too, I don't hear it. Dr. Kama not been talk to me, and Dr. Harris or Dr. Sise, they're not collude and stuff like that. They're all not professionals. You know, they're not going to come lay the profession on the line for lie to anybody. You know. So my family like I say no more. We give una the information for una make an informed decision. Mr. Patrick Dixon, sir. Sorry.
Yes, thank you once again, Mr. Moderator. Now, the thing I'm not comfortable with is the way this vaccine is being sold in our community. And that is, we start out to say, like, 1, 2, 3, 4, 5 speakers and no say, we've been to look for medicine, we don't get medicine. We've been to look for medicine, we don't get medicine. In we own parlance, in we own understanding, in Sierra Leone understanding, when we get medicine, the medicine will cure a disease. This is not what the vaccine is. According to all the other people that we don't talk, all the GPs that we don't talk, they have all said this is not a cure. This will only help you. You should still continue to maintain your distance, do every other thing, all the other protocols you're supposed to still observe it. So we cannot be selling it as a cure to COVID-19.
You're right.
Right? It is not absolute because it gives people false position to assume that when once I've taken this vaccine, I don't get the medicine, I am all right. That is not the case. We should continue to stress to our community and our people to say, this will only help you should in case you get it. Because it's in your system, you will not get as worse as the person who doesn't have that in their system. But it's not absolute. And that is what the problem is, because in our community, we believe same medicine, where once you take paracetamol for headache, it well you headache. So when once you see you go take this vaccine also, you feel say you don't immune to the vaccine. It does not guarantee immunity, and we should not sell it that way to our community. That is my concern.
Thank you very much, sir. Basically, we don't do a show before this one, where Dr. Kamal be explain about vaccine. Okay, now in we own language, where they say medicine, you know, that is same thing like vaccine in a way, but we don't do a show before when we explain what in vaccine be. Vaccine not to really like where you could take Panadol for that. No, vaccine is something they take for prevent, you know, for protect you in the future. If that sickness they for attack you, let your immune system go better. But we also advise people and say, even though you don't take the vaccine, if you take you don't take the complete dose, you still get for be vigilant, i.e. follow the government guidance, i.e. washing your hands, you know, making sure you keep your social distancing and stuff like that. That's what we don't explain before. Unfortunately, maybe you're not being deep at that show. But do you have me if anybody gets the wrong idea, we sincerely apologize because I Krio with the talk. And in Krio, we will say Maclate. And the question we don't do this show before. Now the slide Dr. Kamal show, so maybe it will even touch base on that. I don't know if now they try for do. But we don't talk about waiting at Maclate before. For we explain to people waiting at Maclate and how we they work. So really not to say now a cure they don't get no vaccine is something we, as far as me understand that for me own layman terms. Okay, now something where then give you it will help build your immune system. The system way will fight against sickness them. In case you catch that sickness day in the future, your system will fight them. But Dr. Kamal, I will let you answer than this.
Yeah, that's it. As I say, this is the question that people they say, we're waiting to make HIV, TTD, medicine for them, vaccine, and that. Now the same mRNA vaccine, mRNA virus, the HIV. But as I say, we all don't learn for live with them. But look at this. So when you take a vaccine, not to medicine, no, like how you say you get paracetamol, like how Piman talk and this one. Paracetamol gets your own characteristics. Then one from them na painkiller, you know. Other one the way sometimes they bring the temperature candle, you know. But as it is, the vaccine, which they do, they protect you from the severest form. Now make I put the first slide. I show that instrument where people know sabi about. Now the severest form of the sick. Now in they make them go intubate you. And go make them put that in your throat for put the tube for make you breathe. Not to cure. I want people to understand that. That is not a cure, not by a long chalk at all. And it not going to stop you for transmit this sick. So if you get immunity from the severest form, that no means say you not go catch the sick. And that no means say you not go pass the sick. So we can't tell you how long the immunity will last if you don't take the vaccine. We hope, say, based on previous experience, 6 months to a year, and that we hope for. But guarantee no day because waiting to this sick now, new sick. It just take a year and the vaccine just come out in the past 2 months, 3 months. So we get a long time for study how this thing go help, what it go use for the immunity, how it go last. But it not prevent you, now make you see, if you watch this slide, very important. So when you take the first injection, when they do the muscle, from day 1 to day 12, you not get one protection, nothing, no day. So day 12, now you they begin because the body by then don't get enough message for say, something don't come out your body, you begin build towards that. So you get the antigen antibody complex begin for develop, for begin go higher and higher from day 12 now. So by the time you get to day 21, when the 3 weeks between the first injection and the second injection, when they give you that one day again, in fact, the injection when they give the second one, it doubled the amount of the first one. Then, of course, from day 21, you begin develop this immunity now more quickly, more, more rapidly. So by the time you get to day 28, now you go say you don't get immunity. But immunity now only against the severest form of the disease. As I say, likely to protect you against that. How long it is, nobody knows. and you can still transmit the infection. Yeah, but this is the critical message. Still have to self-isolate through contact tracing. So if you get these symptoms, you still have to continue doing that. And the important thing is, let people not think say this na cure. So that I don't get the 2 injection, yes, I go make nyanga, go show chest. No, doesn't work like that. Because you can still contact, especially now, we will get different variants there. So let people know that this is not a cure, this is not just prevention from the severest form of the sick. I hope so that helpful.
Okay. Thank you very much, Dr. Kamal. Dr. Kamal don't say no more. Dear, my family, and don't yegi. I say no more. Krio, it depends on how somebody they talk and how somebody they interpret them. Okay, but I'm glad the way Mr. Dixon bring up that point there. At least we're able for explaining how to people. So the one that we missed the previous session, it don't make a lot more sense. Okay, Mr. Finney, yes sir.
Yes, thank you very much for the whole presentation. This is one of the things that this is one of the things that I really lack foresee, where we as Salon people they come together for help we Salon people for make the right decision. My own personal view, the right decision is for all for take the vaccine because now the only thing that's where we get now the table as of today. For protection, not for cure. I'm glad the way Mr. Dixon asked the question. And I want to reassure Mr. Dixon, say, if we approach this as we are all in it together, we're probably going to be able for help with people to make the right decision. But when we approach things, like I say, there is us versus them, it does not help our children, our people, if we make the right decision. We are all in this together. He quietly identified misinformation. But when he points them out to say, blaming other people, example like me, who is saying this is the right thing, when he points them out blaming other people for misinformation, I think if we all gather for say, okay, there is some information where can cause misunderstanding, let we all put weight together for clear the misunderstanding. So somebody like Mr. Dixon, with a man who's got some good voice, if he helped for put the case for say, this is not a cure, this is a prevention, something that helps your body fight the disease, then I think we all should say we're all in on the same page. And I look forward to working with Mr. Dixon for able to send that message, say it is not a cure, it's to help the body fight itself, fight the disease. Now, another comment I wanted to make, which is to do with the my own layman's reason as to why we get the vaccine in rapid time. I remember the days where I be young, when you make telephone call, you get for go na slet, you go book a room, you wait for hours, and then you pay your money, and then they say, Mr. Finney, cubicle number 2. You go to cubicle number 2, you wait for the phone, wait, and then let you pick up. Now, that was the days when vaccine would take 20 years because communication don't improve. So we got a massive improvement in terms of communication. Things work from here to here with WhatsApp so quickly. Digital technology don't improve, and we get a bigger knowledge database for going to when you not go back, go begin look at all of the old thing that we didn't do before. And of course, finally, the way with the model stuff, using modeling, it's so fantastic that you can get the model of a new car by just pressing one button. So let's remember, say, yes, it takes 12 words, but the reason for that, including all the one where the medical people and don't put, there are other things about the digital technology, the knowledge database and all of that will make life easier for we for get a quicker vaccine. So thank you very much for giving me the opportunity for explain that, so that we all know, say, we're all in it together. This is not a we versus the others. It's all of us trying for help with people for protect themselves.
Thank you very much, sir. Thank you very much for your contribution. Family them, we appreciate everybody on our time, on our effort and everything, because what you do, if we all can see them, we all agree no more to one thing, we're not learn nothing. But if we get people and we go challenge the status quo, we go ask questions then we some of who don't think in private time, but maybe not feel comfortable for asking the public, we get them people and for me, I welcome them. In my own professional life, I'm always happy for let somebody challenge me, because when you challenge me, they make I think outside the box, think, over the norm, and think, say, okay, this person gets a different point of view. Why? Is there something I can do for improve? There's always room for improvement. So what I was saying, I'm a fan with them, they are big. I'm not saying not all they enjoy the show, but they are big. Time done. Okay. So now they can go around with panel and we can say goodbye. Dear, I'm really sorry. I know say a lot of people never ask questions, but they are the big. We get for cut short, but we'll come back again in 2 weeks' time for cast, for can bring another show. In 2 weeks, we go do dementia when Mrs. Isaac will go by and I go present to we. So I look forward for it. I see you all. So what I go do, I go around the panel. Mr. Cisse, anything that you don't say, you want to say something. So I'll start with you, then I'll go end with Uncle Doc. Okay. So Mr. Cisse, wrap things up for you. What you want to say as a last word to people, please?
First of all, I want to say thank you to all the participants that will come, and especially the new one that will join you today. I want to tell them thank you very much. And obviously, Dr. Kamara gave a very wonderful presentation. And there's something that we say, we want just, buttress now, say, make a point, say, obviously, in the practice within to preach. And myself one time I say, amongst the team, most of you don't take the vaccine. And myself don't take my own. And some of the symptoms, the side effect, the way people are worried and scared about, yes, there are new ones we will find out anyway. But for me, on the day where I take my vaccine, it's unnoticeable and I feel absolutely nothing. Now, on the second day, I feel just tiredness. Other than that, as soon as I can see me, I'm fine. So I want to encourage people and say, look, they meet here what they put around, so not to help it, help way. They push you more than the corner way. If, as Dr. Dolan say, the severest form of the sickness, if you catch we, you gotta make we a lot more. So me and that moment we get for past on all. And please, Lord, try for project a zero negative, idea. Lord, be very positive in thinking, and then they help in the long run. Because me and one person way, I'm very positive in thinking, and I just want to share this with all the audience. Then this is a book what I buy, where I can see and carry zero negativity. That's me. And I believe saying that all of the team members can get. So please, because now then positive messages they want to pass on to now, for educate to now, for learn, I guess for learn, and we say, look, there are times where difficulties will all encounter them, but we have to remain resolute for fight the cause. So that positive thinking they are all pass on together. So thank you very much, Mr. TJ. I pass you back to the next
Thank you very much, Mr. Cisse. I hope say they're not give small thing when I plug that book. I'm just joking. Yes, Cisse, I'll come to you next. What are the last word for people there?
Well, first of all, thank you everybody. Just like how Dr. Ibrahim don't say.
Yeah.
Thank you everybody we join with today. And all the comments that people they make as well, it's good for where people then get their concern, their skepticism, where then they pull them, where then they talk about, just like how you say to me, some people then they want talk the same thing, they're not get mind for talk them. But then you get other confident people where they come forward and say, me as well talk, and so that for help other people. All man don't talk everything what want for talk anyway, you understand? Sometimes we all, me say self, me na health professional. The day where I book me test, I panic. I want to change my mind. If I change my mind, I look at television and they see so many people and they go to take the test. Why make myself not go take them? Then I give me the confidence. Now I go take me test. I go take me vaccination. Sorry, right? So if people and they talk about say, waiting the issue where they're afraid for take the vaccination, waiting at the alternative. There's no alternative at this point for now. Now all man don't talk because na trouble. Look, Jemu, you don't talk. Look how long we don't do na us. All man frustrated. Mental health problem with the picking them. That one then another thing we get for calm. We all now get for truth and back, right? So at the big number say, we all think about for say we need for go forward. And the only way forward now for let we try for take the vaccination and stick to the government in rule and guidelines for say washing, face masks, this safe distancing until eventually by God in power, things will be okay for we all. That's all I'm thanking you. Yeah.
Thank you very much. Dr. Ture? MZ Ture, now we on Ture, not to
Yeah. Thank you so much. A very, good presentation and a participation with everybody. So excellent. Dr. Kamara do a very great job here. But this actually now for we people, all we can do now for sensitize with public, tell them what we know, and just as how JT they talk, we just want follow and make informed decision. Okay, you use your own idea and make your decision, and members say people and they back with you where we need for protect yourself. So the advice with government they give with Falaram, people learn not for forget about mask. Okay, some man they take mask and they put under in chin, but the essence of mask now for cover your nose and your mouth. So not forget, not just forget, because we need for protect ourselves. If you go to the shops or you go to somebody, neighbor, not go too close to them, wear your mask, then are the very great prevention and the way nobody not go argue about. So, but we did no say, we try for prevent ourselves, prevent with community. The Black people and die so much in this. And I'm saying to people that COVID is real. Let nobody not tell you say no real. Every day we see people in the camp and with symptoms of long COVID, with symptoms various forms of COVID. Some man not get even cough or fever, but you just get skin condition, different skin condition. Then test a positive. And people in the car, you talk to them today, tomorrow, they cry, say impossible, don't die. So it's real. So thanks to everybody for the participation. We hope say we will continue for come to this show and get more information about other health problems. Next 2 weeks, we'll get dementia again, we'll get to talk about, and I hope say people will come and participate. Thank you so much.
Thank you very much, Dr. Ture. Next, Auntie Aziza, I don't know if you're in a position where you will say something to people as a last word.
Yeah, no, I just want to say thank you to all man with the education is key, knowledge is power. And Agladi, yes, beaucoup people then they where they challenge and ask questions there where they make me think Agladi for that too. I just want to say, please, all man, like Auntie Rugi just say, please continue to follow the guidance, because the new variants where they they spread fast. And like Uncle Dr. Kamara don't talk, say, beaucoup people in there where no they get any symptoms at all. And then are the, what do they call it, the spreaders, and they spread them to beaucoup people then. So all man, if they wear the mask, they just wear them for yourself. You did wear them for all man where they, because you know one that for the night you conscience, na me get that person. And then the other thing, you not gonna know whose side you pull the virus. There's no definitive way of knowing for sure. So the best thing to do is to protect yourself, be safe, follow the guidelines, and yeah, continue to educate yourselves like you're doing right now. I'm so pleased about the participation, and I'm so grateful to be here. Thank you.
Thank you very much, Dr. Sise. For the people that we don't know Dr. Sise, I will show now a picture. But I know about not call it my sister. I don't mix. Not Dr. Sise this. I know about Mr. Sise, I said I know about not call it. I laugh. I don't like so. Dr. Sise this. Okay, thank you very much, Dr. Sise. Uncle Doc, you get any last word for people, then, sir?
No, you don't miss one person, no.
Now that Mrs. Goba be don't go, it be say they go work.
Mrs. Kamara there.
Mrs. Kamara, hey, Auntie Kamara. I don't see her. Auntie Kamara, you got any last word for people then? Where's me Auntie the bluff?
Thank you, everybody. What do you make one for add, Sister Rugi mentioned, and that now the impact of COVID on mental health. If we look at research, and the last a couple of weeks, we did see a lot of teenage people and they take their life. They see adults, them, the symptoms of depression, self-harm, they increase because they can't cope with lockdown anymore. So for that, we just keep an eye out on people them around we, check on them, and just encourage people there for talk, because the more they talk now, the more we did know, say yes, then they struggle, and hopefully give them tips on how for manage. But like our doc say at the beginning of a presentation, the impact of mental health, especially post-traumatic stress, will be really, really high in the next couple of months and years. So let we just pay attention to picking them around we, and we seniors, as well as we, we colleagues them. Just make sure say everybody they function okay. Yeah,
thank you very much, Auntie.
Yes, sir.
Okay, Uncle Doc?
Yes. Well, thank you so much. Grateful for the attendance, and especially Mr. and Mrs. Binks and Brian. You're the highlight of this presentation, and I'm sure people were pleasantly surprised to see you, to hear it firsthand, from the metaphorical horse's mouth, that you lived it, that you know exactly how you felt, and, the impression you got when, somebody stands in front of you and tells you that, look, should your heart unfortunately stop, that's it. We're not jumping up and down. Now that fills me with trepidation, I can tell you that for free. That's part of the job that I do not like as being a medic, breaking bad news, especially when I think it's terminal. That must have left you feeling really deflated. But as it is, it's even compounded because of the fact that you want, your usual self, you want thinking as you should, as you would normally. So that, makes me really, really think long and hard about how this message is to be carried forward to the people who are not so lucky to have listened to what what you went through and what you still continue to go through. People deny the existence of COVID, let alone long COVID. Now you are, if you like, a living witness to that. And for me, that's very important. I don't think there could be any more powerful testimony than the person who's actually lived it, who's experienced it, who's been through it. You can't have anything more important or more powerful than that. So I thank you from the bottom of my heart. And I'm really grateful for the time. Look at that. You still stayed with us. You're still with us. And for me, that is absolutely, you've gone so high in my estimation. I'm really grateful for that. And I tell you what, this hasn't gone unnoticed at all. So on behalf of the team, on behalf of the community, I really have to thank you profusely. So thank you so much for being with us. And for the rest of the people who attended, well, the people this sick in the pico. I want people to understand in the peak. If not lie, ask Donald Trump. If not lie, ask Boris Johnson. If not lie, ask Prince William. If not lie, ask him Papa Prince Charles. If not lie, ask Idris Elba, William person. If not lie, ask the professor when SSFN Ebola. They all don't catch this sick. Now you go say if you get money, you go balance that. Usai. But we, the black man, now we, they suffer from this. Now make, as I say, the only thing I go advise person for make it be selfish, but we young people them. Now, look after number one before number one look after you. Please, 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 me people them. I'm not going to force anybody. I go only do what they are able for talk to people them. Give them the information, give them the knowledge, sensitize them, make them know. Say, I tell you what, this thing big. We don't even begin for dealing with it because if we talk about mental health, then they come later. But I tell you what, the number of rapes where they go unannounced, unreported, the number of domestic violence, you understand? The poverty we get for torture, the number of farms that we don't fold, and look at them picking them, 1.6 billion picking the dinner house. Now we future than the day. In the next 25 years, we cannot claw back which we don't know so in this 1 year. So do ya with people them? Let me think long and hard about this vaccine. So man, they cry for get them, they not get them. So do ya, we will get the responsibility for scatter this world, make we do so. If you're able to take the vaccine, good for you. As so, please say you could take that on board. If you not take them, well, As I say, if anything happened, I need to blame anybody for that. And I need to say, all man for taker, because some man do not for taker. But please think twice that this is not the possibility, especially now we will face the one day way they change like this come here. But remember, if this thing monitor you, not suffer in silence. And one thing we know, well body, Bɔdi Bεttεh pass Gentri. You can get all the money in the world, but if you not get well body, believe you me, now the sick now go take you. So please, 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 I thank you very much, and God bless we all.
Thank you very much, Dr. Kamara. To Anne and your husband, I think Brian, would like to thank you very much. I think Uncle Doc, Mr. Kamara, said that already, the chairman as well. I would like to join them to thank you guys very, very much for joining and also for sharing your experiences with us. We fumble them into Nasi. With man, this you not say, oh, they not like me, or na racism. If a white person can be sick and then pass that type of message to that person, it should say it can happen to anybody. So please, as the medical professionals have, do advise the other people them. Let's be very, very careful. Okay. Okay. On behalf of the Salon Organization of Greater Manchester and the Bɔdi Bεttεh pass Gentri, and just to explain what this whole Bɔdi Bεttεh pass Gentri mean, it means simply put, health is wealth, or if you're healthy, is much more, it's worth more than money. That's what it means. Okay. So I would like to thank everybody for what I do attend today. And we hope for soon again. In 2 weeks, we will deal with dementia. On our all, have a good week, rest of the weekend, and stay safe. Good night.
Thank you.
Thank you so much, everybody.
All right.
Thank you.
Thank you.
How am I quiet for today?